Hi everybody, welcome to week 10 of your practicum course. Nice to see you again. I've noticed a little bit that you guys must be like really in the throes of your practicum experience because I haven't seen quite as much dialogue in our main form, but it's okay as long as you get the information and you think about it and you get in your required number of posts, you can get your points. I know it's a busy time right now. So last week we talked about change and leadership, that sort of thing. And one of the components about change was addressing it in a culturally sensitive manner, right? So now this week we're going to dig into that more. Our DQ question has to do with how do you advocate for change in a culturally sensitive manner? How can cultural sensitivity assist you in overcoming barriers and resistance to change? So when we talk about change, regardless of which model you use, you've got to kind of set up the change, right? And to do that, you've got to explore the institution and the people who you're asking to implement this change. And that's where cultural assessment comes into play. And hopefully having some cultural competence as a result of that assessment. So in other words, you got to know your culture, okay? The people, the institution, the healthcare organization, what is that culture? It's interesting. I was just doing a little Google search about cultural competence just to kind of look and see what's out there currently. I came across a website by the Substance Abuse and Mental Health Services Administration. Kind of an interesting article, actually, because if you think about it, addressing substance abuse and mental health, you really have to address the culture that the individual is in or they're not going to be successful. Anyway, they define cultural competence in a couple different ways. The ability to interact effectively with people of different cultures, okay. To be respectful and responsive to healthcare beliefs and practices and cultural and logistic needs of diverse population groups. And I thought that brought in some real kind of beefy, meaty things. What are the goals of your organization? What is the underlying culture? What are the values? How about the people that you're working with? What are their values? What is important to them? Do you have a lot of people who are committed to the organization? Do you have a lot of people who are really committed to enhancing patient care, patient safety maybe? So many things to consider. And remember, when we're thinking about culture, we've got to remember, as this organization reminds us, that besides race and ethnicity, culture covers so many different things. They, for instance, bring up age, gender, sexual orientation, disability, religion, income level, education, geographic location, profession, right? So there's so many different factors of culture. What do people emphasize? What do they place higher value on above other things? Because part of the change process, to be real honest, is selling the change. Now we know we're going to try to bring up our evidence, our research, try to show why the past situation was not effective, so you want to bring about a new state of being. And part of that is selling the change. You will be called upon to do that. And so if you don't know your audience, that process will not be as effective. In Kurt Lewin, the unfreezing piece of it, okay? And then how is that change going to be effective? Is this a culture that values informal leaders? Is this a culture that values formal leaders? Is this a culture that values chain of command? Is this a culture that values individual autonomy? Those things are going to really impact how they are going to respond to a change process. So lots of things about culture. I am going to include two articles that I'm attaching to this video, and they're both about change processes, health change processes in different communities. One's about an African American community, and one is dealing with an older Latino community, and how they use the culture and also religion to actually enhance change. So they're not too long. You can kind of skim through them and I think get the idea. So I'm going to attach those. Anyway, so I think this is an interesting topic. A lot of you have told us that you work in quite diverse organizations with people from different ethnicities and backgrounds. And so I'll be interested to hear your thoughts about change and how this cultural sensitive approach can help us with that change process. Also, I just wanted to share with you something that happened at work this week that was really interesting. So I've worked as a staff nurse. I've worked in the hospital for lots of different times, different big hospitals, small hospitals. And so I'm used to assessing patients, seeing they're going downhill, intervening. It's just what you do as a nurse, right? So my full-time job is working in a school district. I primarily case manager higher acuity students in special ed population, those that have special needs. The school where my office is located, I have a ton of kids with special needs. And I was helping with one. It's a young man who has muscular dystrophy. He doesn't have a lot of movement yet. He can move his hands a little bit. He can move his head a little bit. And his chest wall muscles are very, very weakened. And so he had just come back to school after being off a week. And he was having some difficulty with secretions. And in the hospital, I could just whip out the oxygen and the suction and we were good to go. That didn't happen. That doesn't happen in the school setting. We just don't have that things. It was just me and the staff and my stethoscope and pulse oximeter. And I ended up actually having to do mouth-to-mouth resuscitation to bring back his respiration before the ambulance arrived. And so you just never know in what situation you're going to have to use those nursing skills and abilities and that critical thinking and prioritizing and those sort of things in places that you maybe wouldn't expect. So just another plug for continuing education, lifelong learning, and all those good things. Anyway, just thought I would share a thing that happened to me this week. All right, guys, so week 10, you're going to have your NEPD due again. I think there are a few of you that also have not yet turned in your midterm evaluation from your preceptor. And if you're getting close to those 75 hours, really think about giving that form to your preceptor so we can get everybody's midterm evals completed. And I think that's about it for this week. I'll see you in the main forum.